We want to talk about digital eye strain now. Like, I know that it's something that we hear about at work, that you have to be careful of it. It can cause headaches. It can cause all sorts of problems. But digital eye strain is also a problem that can affect children. And I think probably it is something that, I'd like to welcome Dr. Farrah Sunderji to this. Doctor, I think this is probably something that we tend to maybe underestimate in kids.
That is so true. I commonly see digital eye strain in the office on a daily basis, not only with adults, but definitely with kids. And what digital eye strain is basically it's the discomfort that one would experience after using a screen for more than 2 hours. And we're finding more of this because even just in the elementary age group, we're finding that children spend more than 4 hours a day using a digital device at home or at school, and that number increases to about 8 hours for teenagers.
Is this something that is it's an uncomfortable situation, or is it something that can have medical long-term effects?
Sure. Symptoms of digital eye strain include headaches, blurred vision, eye irritation, tearing or dry eyes, increased blinking or squinting. In fact, a new study done by the Alberta Association of Optometrists found that 59% of Alberta parents are not aware of nor do they encourage their children to take steps during or after using a digital device to reduce the impact on their eyes.
Well, and I think, as a parent, when we talk about limit your screen time, I'm thinking of it more from, get outside and play, do some more homework, let's read a book. I'm thinking of it more as a behavioral thing, not necessarily as something that could be having a negative health impact on them.
For sure. And you know what? If you don't know if your child is suffering from digital eye strain, the best way to know is to bring them in to your optometrist for their annual eye exam. We can evaluate your child's eyes and recommend solutions based on their digital habits to help prevent discomfort. In fact, Alberta Healthcare covers annual eye exams for children between the ages of 0 to 18. And back to school time is the best time to ensure your child is seeing well and that their eyes are healthy before they hit the classroom.
And what about, to me it seems inevitable that we need to have some screen time present in our lives. You see it at school, it is a way that we can do homework. It's a way that we're communicating with each other. So I think it's very difficult to imagine that we're going to ever eliminate it. And I don't think you're asking for that. But what is a healthy amount that kids and even adults should be using these screen times, or how do we put in these breaks and help ourselves out?
Sure. In office, I generally recommend no more than 2 hours in 30-minute blocks. In fact, I recommend parents to encourage their children to take preventative measures both at home and school, and those can include taking frequent breaks, following the 20-20 rule by looking 20 feet away every 20 minutes for 20 seconds. I also encourage children not to hold the screen too close, preferably at arm's length. They can eliminate screen glare by reducing overhead lighting or even just adjusting the screen brightness. Ultimately, when you come in to see us for your annual eye exam, we can actually review these one-on-one with you based on your digital needs.
What is it about the screen that's a problem? I was a voracious reader as a kid. Would read for hours and just focus on small print in front of me. What is it about the screen that makes it worse?
So there's a couple of things. We have a higher exposure to blue light, which causes eye strain. And then just staring at a screen, we tend not to blink very much. In fact, people typically blink 12 times a minute, but when you stare at a screen, we actually reduce that to 5 times a minute. So basically the eye is not getting proper lubrication, which eventually leads to eye strain, dry eyes, and fatigue.
What if you were to implement, conscious, okay, I'm going to blink more, I'm going to, is that a way to help yourself out, or is it just best to take those breaks?
I think it's a combination, to be honest. Looking far away definitely helps with the focusing system, relaxing it, and then taking proper blinks actually helps activate the tear film and the oil glands, so that way the tears are properly distributed and you're getting enough of it.
So how early are you starting to notice this in kids? Is it something that, you'll see in kids at a very young age, or is it something that tends to show up when kids are a little bit older, as they are, getting into 4, 5, 6 years old and more at school age?
So in practice, I do see a lot of children, and I would say that I'm actually starting to see it below the age of 5. I have kids who come in and parents will frequently say, my child is blinking a lot, or their eyes are really tearing. And my next question will be, how much digital time are they having during a day? And it's quite surprising to see children under 5 where, they get 3 to 5 hours a day, which is a bit excessive.
And does this include televisions across the room, or are we talking strictly, iPads, phones, things like that?
It's any digital device. So whether it's a television, computer screen, iPad, cell phone, it's the combination.
Very good. Doctor, thank you so much for your time and for your insight today. We really appreciate it.
Thank you.